We are starting to see an uptick in COVID cases in certain parts of the United States, as well as, of course, continuing around the world. With the Delta variant being increasingly predominant, this has been an increasing concern for the market as well. Let's bring in Dr. Payal Patel, University of Michigan Infectious Disease Physician. Dr. Patel, thank you for being here. First of all, I'm curious about data when it comes to Delta. Are pretty much all COVID cases in the United States now being tested to see if they are indeed Delta? How reliable is that data, and what are we learning from it?
Yeah, so it depends on where you're tested. So most cases probably are not being tested, but we do know that a majority of new cases are actually rapidly becoming the Delta variant. It's very difficult to do kind of some of the testing involved. And so usually in most countries, only some samples are sent for some of these specific tests. If you were to walk into like an urgent care, or if you think about buying a test at Costco and doing it at home, that wouldn't necessarily be sent out to know what variant it is. However, big hospitals do send these off. And what we've seen is in the last month, now more than half of cases are the Delta variant. So we are seeing a rise in that in the US.
And we are also hearing anecdotally, at least, about more so-called breakthrough cases. That is, cases rising not just in unvaccinated populations, but in vaccinated populations as well. Anecdotally, I've heard about this. There was a report as well among some workers at a hospital in Las Vegas, some among vaccinated workers who were diagnosed with COVID. Again, how good is the data on this, and does it sort of mesh with the sort of 95% efficacy of many of the vaccines?
Yeah, when you think about it, you think about this virus, it's been out and about for more than a year, and it's had all of this time to figure out how to get stronger, how to spread easier, how to make people sicker, and it's done all of those things. Luckily, in that same year, we've come out with all these different vaccine options for people to get vaccinated. So that's really the thing to keep in mind. The virus has gotten stronger, but we're in a different place now than we were 1 year ago. So I would say if you have gotten vaccinated with both doses, now that's the key, you should feel good about doing most of the things. Yes, there is still a chance for a breakthrough infection, but most of those cases in people who have been fully vaccinated are mild. If you've only gotten one shot or are unvaccinated, those are the folks that are ending up in the hospital or in the ICU now with COVID.
So I guess then if we take a step back, how concerned should we be about the Delta variant and about the current spread that we're seeing? Is it in fact, less dangerous because it's not making people who are vaccinated very sick? Or is this still an acute situation that we really need to be worried about?
Things have definitely changed over the last year. It would be ideal if we could get most people vaccinated with both doses. If we could do that, we could stop the virus in its tracks and it would have less chance to become smarter, make us sicker, and so forth. That's why, as a public health community, we're still focusing on getting the unvaccinated vaccinated, getting people with one dose, their second dose, and focusing on kids. When are we going to get that huge population vaccinated as quickly as we can so that we can stop this virus from evolving? I would say if you have been fully vaccinated, you should continue watching the news and like kind of see where you're going, but you should feel pretty good about returning to some of those activities that you've been doing before.
For the people who aren't vaccinated, who we're still trying to convince, the news out of Johnson & Johnson about its shot and the sort of, as I called it to a colleague, vanishingly small risk of getting Guillain-Barré disorder. Does it hurt more than help in the vaccine push effort to come out with information like that?
I think luckily where we are now in this nation, it's fairly easy to get a shot these days, right? You can go to a pharmacy, you're kind of a glut of vaccine out there. We're really kind of different than it was in other countries right now and earlier on. So what I would say is, look at the different vaccines, look at kind of the options. If you're concerned, if you're someone who's unvaccinated, concerned about hearing some of this news, even though these side effects are extremely rare, this side effect that's been listed with J&J hasn't been listed with the mRNA vaccine. So if that's stopping you, go for an mRNA vaccine. You kind of have a choice now. So that's how I would really think about all of this news that's been out there.
That is a great point. Dr. Payal Patel, thank you so much for your perspective here and your expertise. University of Michigan Infectious Disease Physician.